Hello, thanks for tuning in to the Talking Issues series. I'm Curt Pringle, and I appreciate you listening in. So today we're going to talk about maybe a little controversial issue, challenging but very significant, and an emerging issue that a lot of people need to become aware of. That's why I have invited a couple special guests here, and that is the topic of medical use of psychedelic drugs. And I hope I have captured you to listen to this discussion, because it really is important, and it's different than a lot of the other things you may have been hearing. And today I have two guests, first time ever, two people sitting here. They're going to share their great knowledge in this area. One, a longtime dear friend, former city councilwoman in Orange County and mayor and assembly member and state senator, a candidate for state treasurer. I know all of the qualifications there. Former Congresswoman Mimi Walters and her son-in-law, John Kostas. So glad you're here, both of you.
Thanks for having us.
Yes.
Excited to be here.
Yeah, so this is, I kind of want to set this table, because a lot of people, when there's ever a mention of drug legalization efforts, of which I have always opposed all the stuff in California to legalize marijuana for medical use or everything else, I think a lot of people are stuck into that experiment that California initiated back when a voter-instituted measure created legal marijuana for medical uses. And then it evolved into for recreational use.
Right.
So a lot of people, I would say, are tainted with that perspective of this whole conversation. So how do we separate that right from the beginning?
Yeah. So that's a very big challenge. And I am right in line with you when it comes to the legalization. I'm not a supporter of legalization of marijuana either. And that has been one of our biggest challenges as we've gotten into the space. We're using psychedelic compounds to treat different mental health issues, but it has to be in a very controlled environment. And what we're distinguishing between what we're working on versus what we've seen in California with the medical marijuana use is these compounds, these drugs that are going through the FDA trials to treat different mental health issues such as anxiety, depression, addiction, PTSD. They're having data that is being used, so we can see from the FDA trials what is success and what is not success. And that's very, very important to get that data.
So that, I mean, for people to understand what, again, we know what the initiative process is in California. Somebody writes an initiative, legally puts it together, gets signatures for it, it gets on the ballot. At that point in time, there was no ability for the public to modify that, or for the legislature even to modify it when that was put before the voters. So that was someone crafted it for whatever purposes they wished. And that's how medical marijuana started in California in the early 1990s, I think.
Right.
And therefore, then it piggybacked on top of that to grow to recreational use. So you didn't have to show a medical reason. But the point is, there was no requirement back then to have a doctor's prescription, to have a dosage prescribed, or any of that, which is the total opposite of what you are talking about in terms of psychedelics to be used for medical purposes through a treatment plan prescribed by a doctor.
Mm-hmm. Exactly. And what you've seen in some states, like in Colorado, they just had, I believe it was in Maine, an initiative to legalize psychedelics. And I believe in Oregon, they actually passed an initiative to legalize psychedelics, and it's completely backfired on them now.
Right. Because, for example, with marijuana, the strength of marijuana itself has become so much more powerful than it was in the 90s. Therefore, that you're not even talking about the same recreational drug, but psychedelics under this discussion are totally different. It's not for recreational purposes in any way, and we're going to hear about that.
Correct.
Right.
Correct. Not at all. I want to emphasize we do not support decriminalization or legalization of psychedelic drugs at all.
Yeah. So I mean, as a starting point, that is just such a high hurdle to get past. Not one that you should ignore or not proceed with these efforts, but it is a high hurdle in people's mind.
Sure.
Where that starting is when they hear psychedelics drugs, be it ecstasy or LSD, things they've heard about that are street drugs, but in fact, some of those drugs being used for very targeted purposes.
And we have to do a tremendous amount of education
Yeah.
to make sure that the public understands that these are drugs that are helping to cure serious mental health issues. But again, they are in a controlled environment. Just like you're going to go to a doctor to have a surgery or something, you're
Right.
going to be in a room where you've got doctors that are administering this drug. You're not taking the drugs home and taking them. You're not going
Right.
to a pharmacy to
Right.
take the drugs and go home and take them yourselves. You have to be under a controlled environment for this.
Yeah. So I guess, and I don't necessarily know, maybe you do from your legislative experiences, but certain drug testing of this in terms of psychedelics used for mental illness, PTSD, addiction, other things, those trials have been underway for a decade or so.
Correct.
Right? So
Yes.
so people may see today as, oh boy, wow, why are you talking about it? In fact, there has been those initial drug trials and tests, and therefore the successes are what is leading to a stronger movement to be able to really go through the full FDA approval process.
Exactly. And we are hoping and we fully expect within the next 12 months, there will be an approval of a drug, of at least one drug to treat depression that will be approved by the FDA.
So let's introduce John to the conversation here. Thank you very much for being here, John. I know you came here in your own free will, not because your mother-in-law said you had to talk to me.
Big fan.
Oh, thanks. But your story is such a good and clear one in terms of this discussion. I know that's why Mimi's involved, because of your great experience. So maybe you could just tell us a overview of your story, what led to the path of your cure.
Yeah, absolutely. And prior to enrolling into this trial, I was treatment resistant. So I was, the worst of the worst for alcoholics out there that tried rehab, and at my own free will again. This wasn't a court-ordered thing, or my loved ones didn't say, we're giving you an ultimatum. I mean, I truly wanted to go and stop. AA, I mean, my first AA meeting was at 16 years old. And I mean, you name it, I tried it. And I was in New York, so we had access, to some of the best facilities and doctors and specialists, and
a lot of booze.
And a lot of booze as well.
Yeah.
So perfect storm. And none of that worked for me. And I was just shocked and really dismayed and pessimistic about this whole outlook, because every doctor I saw, they were basically said, you're going to have to live with this for the rest of your life. And I was always afraid of my future self, because I could be having a good day right now. I just don't know what I'm going to do tomorrow. And that was terrifying. And I never experimented with psychedelics, never touched them, never, just out of pure fear. Yeah. And I heard about this trial by happenstance and total luck. My mom, who's also not, she's pretty against drugs herself and always warned us against drugs. But we're just all desperate as a family that, hey, if there's any study out there, we're happy to try it. Yeah. So I enrolled in this trial. There was an intensive screening by the doctors at NYU Langone. And they, said I was mentally and physically okay and fit to go through.
So, I mean, through this kind of process, your evaluation, you have to be qualified to be able to take that next step in a trial, right? They want to make sure you don't have something else underlying, it's schizophrenia or something else that could be set off by the use of psychedelics.
Exactly. So they're screening for schizophrenia is the big one, that they don't want, the participant to have a negative reaction and exacerbate any underlying symptoms or other indications that they're living with. So, and I had a laundry list of questions. I thought this was almost, going in for a lobotomy in a way, like one flew over a cuckoo's nest. I didn't know what I was, so I just wanted to go ask the
But you were
question.
desperate at that time. You're to try to break out of that cycle.
Exactly, because if it weren't for this, I was pretty much dead. I was in the, I believe, 95th percentile for alcohol consumption. So, it was definitely something I needed to address and address quickly. Because I was 25 at the time. The doctor said I'd be dead at 30 if I didn't do anything. And so I went in there. There was that mental health screening, the physical, and then we had a few, hour-long psychotherapy sessions preparing me for something that I just never experienced because I didn't know what I was getting myself into. I had never tried these drugs, and they prepared me. They basically said if something comes up, it might come up for a reason. Try not to fight any of these emotions or feelings or visuals, and just kind of see where it takes you, and give up control. So after about a month or so of that, then I went into my very first psilocybin session where they, screened me.
Well, that's the drug.
The actual drug. It's one of the compounds in hallucinogenic mushrooms. And this is the synthesized version of it. So I've never taken mushrooms. I've only taken the synthesized version of that drug. It's, graded, tested. It's pure. And it's precise. So they know exactly what they're giving you.
So here you volunteer for the trial.
Yep.
The trial starts with physical, mental evaluations for qualification. And then there's a period of time before you start your sessions.
Yeah, preparation.
And then when you have your sessions, I think I saw one of the videos with you through the session in terms of it is a supervised session while you are, you take the drug. It's not like, hey, take this home and call us in the morning.
No, exactly. So there were, in my case, and pretty much all of the trials going on, I think all of the trials, not pretty much, there are two licensed professionals, medical professionals, supervising the patient. And this could be, for some of the longer lasting compounds in these trials, it could be, 6-8 hours or so. So it's intensive. You're in a hospital setting. You have a whole medical team there if anything went wrong. And that's why I felt comfortable doing this. I had real doctors there. I was in a hospital setting. If anything went wrong, they were there to handle it for me. This was the first controlled trial. So it was a double blind. So roughly half of the participants got the psilocybin. The other half got a placebo. So I was just praying I got the real thing. And I was lucky enough that I did. And I was lucky again that it worked. So, I should have bought a lottery ticket after all of this.
So you have your first session with that.
Yeah.
So is the whole plan multiple treatments? Or was it a one-time? You had multiple treatments, right?
In my study, it was unique because there were multiple treatments. A lot of the studies, it's just one and done.
Okay.
And so the first two sessions were what they call a controlled environment and controlled sessions. So if you're in the placebo group, you get the placebo for those first two. If you're in the active group, you get the psilocybin the first two trials. Then on the last one, because they saw that there was efficacy for just one time, they wanted to give everyone a chance to, hopefully get better if this worked for the first time. So the third and final session wasn't what they call an open label. So everyone knows that they're getting the psilocybin, and only for the people that wanted to get it. I'm assuming everyone wanted to get it. That's why they enrolled. But they left that option open. It was never forced on them. And even when I went in the first 2 sessions, they said, if you don't want to do it today, totally fine. Don't,
So how long
Don't
did
worry.
this whole trial last?
So the whole trial, I think start to finish was about 54 weeks. So a little over a
Okay.
year. And
And then what did it, so you're saying the first treatment had an impact on you?
the first treatment had an impact on me. And this was over 10 years ago. So I'm trying to
Oh, okay. Oh, I
make
want to be
sure
precise.
it's as accurate as I can recall. I mean, I remember this was all premeditated. The doctor said, please don't drink. I think it was 11 days prior to your first session.
Yeah.
And then so I counted backwards from the calendar of the day, and I said, okay, this could very well be my last day of drinking. And it was. And so I planned it out. And going in, I, took a drug test too, that morning, and then I had an intention. They said, "What do you want to get out of this trial or this session, this
Yes.
specific session?" I said, and I knew I was there for my drinking, but I couldn't put a finger on it, on why I was drinking. I had nothing to complain about. Everything was good on the surface, and so I just knew I wanted to stop drinking, and I was miserable when I wasn't drinking. I was miserable when I was drinking. And I felt weird about, this whole thing. And so I said, I want to find an inner peace. And I'm not a Zen guy by any means. I'm still, a classic New Yorker. But it really helped, give me an inner peace. And I just felt content, and I wasn't worried about anything else, going on. You know, uh, it was almost as if I was just laser focused and had blinders on from after
So
that.
so the end of that story
Yeah.
is ongoing, but the treatment resulted in a total break of your desire for alcohol or ever drinking again.
Yes, it didn't. I'm not a prohibitionist by any means.
Yes.
But it just totally took it off my radar. And I'm pretty indifferent to alcohol
Yeah.
whenever I'm around it.
And compare that to where you were before. I mean, it was you were saying you're a severe alcoholic, meaning once you have a drink, you're going to keep drinking until
days, sometimes weeks.
Yeah.
And that's how I would drink, kind of on these benders, because I couldn't limit it. So I would, look at 3-day weekends coming up, because it took me multiple days to recover from a hangover. So talk about premeditated and going through the calendar. I was
Right.
very good at, the logistics part of that.
So this is one of the areas that psychedelics has, through multiple trials and such, has proven success in terms of addressing drug and alcohol dependency, addiction.
I mean, absolutely. And the research started in, LSD was, I think, first discovered by Dr. Hoffman in Switzerland in the mid-1930s. And so they were doing a ton of research, and that's how this research actually started. It was LSD with alcohol use disorder in the 40s, 50s, 60s. And then, of course, after the 1970 Controlled Substances Act, a lot of that research stopped, and then it got revived. There was some research that got revived in, I think, the early 90s, and small studies. And then early, I think, 2006, Johns Hopkins started studying psilocybin a little as well. It was still very difficult to study, but really in the last 10 years or so, that's when this kind of second wave or so of research came
And
around.
so what did that psychedelic that you took, I don't know if I can say
Psilocybin. Yep. Nailed it.
so there's multiple, like LSD or
LSD.
MDMA, I
Yep.
think, which is some ecstasy-like
Exactly.
compound. So in this case, they have narrowed it down to psilocybin that has an impact on alcohol drug dependency. Is that
Yeah.
how that is targeted?
Yeah, for one case.
Yes.
Another case is major depressive disorder, treatment-resistant depression. And there are and then LSD for generalized anxiety disorder. They're looking at that. These are the furthest along.
And that has touching in the PTSD area, right? For
And
veterans, is that?
Well,
What's
the
no, that's
MDMA, the
MDMA.
MDMA is PTSD.
Good. So just I mean, you might not be able to describe it, but what did it do to you? I mean, for someone like me who's very naive about all this stuff, I mean, how it obviously affected your brain or changed the way signals were accepted and responded to. So what were you told? How did it impact you, be it physically or psychologically?
So, and great questions. You know, doctors are still trying to figure out why exactly, you know, this works for some of the participants. The FDA just looks at safety and efficacy. They just want to see that this is safe to do for first and foremost. For me personally, it gave me a different perspective on my drinking and what it was doing, mainly to my loved ones, and how worried they were about me. Whereas the whole time, and addiction is a very subjective disease where you can always, at least for me, I was justifying my drinking where I was really young at the time. And I didn't have a family that relied on me. I was still going to work. I was still doing well professionally. I wasn't doing anything criminal. So why couldn't I drink? I'm a, you know, young guy in New York. What am I supposed to do? Move to a monastery in the mountains? And
So you hear they drink there too.
I did, yeah.
So that might have that true solution.
Could have been a good fit, but
At least that's what some people tell me.
And so this was the first time. I was always making excuses for my drinking.
Yeah.
And this was the first time during these sessions where I saw my drinking for what it actually was and what it was doing to my loved ones. And I felt this tremendous guilt and shame and embarrassment of, you know, what am I doing? That it was just an awful feeling putting mainly my parents through this, because it was like they were watching a car crash in slow motion and they were totally helpless.
So do you think it physically changed anything, or do you think it just allowed you to get a deeper understanding of a perspective and the impacts of life? That I mean, maybe to reel it back, you were sharing with me earlier about some PTSD and how some veterans who come back who have PTSD are able to put that aside in their head, some of those responses to some of the tragedies that people have seen, set that aside so it doesn't have the same level of impact and response. Am I saying that right?
Yeah. It from the study participants in these PTSD trials, mainly for MDMA, they were able to, under the you know, influence of that drug and what the doctors there kind of you know, dull down and quiet down the part of the brain that is your flight or flight mode.
I see.
And so then they could walk through some of those traumas with the doctors, but in an unfearful way. And almost in some cases, I've even heard like a loving, empathetic way where it's a total shift. And a lot of those folks came out of it with these long lasting, and to this day, I still talk to some of these people that have done this in over 10 years ago as well, where that's just had a tremendous beneficial therapeutic outcome for them, where they resolved a lot of this trauma. And to your point about, you know, these being controlled substances and some folks doing these recreationally, the at least for the most part, a lot like psilocybin, I had no desire to then go find psilocybin to do this ever again.
So really, I think that is so good for people to hear. So you basically had all of this prep ahead of time to make sure you were a candidate that could take this treatment.
Yeah.
You went through the treatment under a supervised medical relationship with psychological and physical people there to be able to address any crises that you may be going through at that time. You had a total of 3 treatments, and that's it.
That's it.
So it's not like a lifetime drug or a lifetime procedure. It is a correctional action, and then it stops.
For me, that's how it was, and I almost explain it like an antibiotic. That when I had strep throat in high school, I went in, they gave me an antibiotic, I took it, and I was done. Similar to this, I just see a doctor for an annual checkup, a physical every year, once a year, and I've nothing else. I'm not going to meetings, support groups. I'm not taking any prescriptions. I'm not taking any illicit drugs. So
how much different? I mean, really, Mimi, sitting here thinking about it and hearing John's story, and yes, I've watched a couple of videos where you were on national TV presenting these ideas, and I think it's really important so people hear all that, and you're such a clear presenter of that process, so thanks. But Mimi, isn't that one of the challenges? I know after you left Congress, this has become one of your passions, to be able to get out to people and to share with them the importance of that medically prescribed option of psychedelics to address very clear issues and problems.
Yeah, and it's taken us a tremendous amount of education. Talking to my former colleagues on the Hill, and John and I have spent several years just going from office to office, and we thought as Republicans, conservatives, it would be much more difficult to get them to understand. But taking John with me, they totally understand.
What, is he a registered Democrat? Is that the issue?
No. But him just telling the story. I'm saying we're conservative. My former colleagues being Republicans and more conservative, I thought I was going to have a difficult time having them see the value in this treatment.
Right.
And pleasantly surprised, very open. And what I found was so many people have somebody they know, it's either a family member, a loved one, a friend that has struggled with mental health illness.
Right.
And they all of a sudden have opened up to us as we've gone on these meetings as like being desperate to find some sort of way to handle this and to cure them. And when they've heard John's story, there's like, oh my gosh, there really is some validity to this. One thing I want to share with you is that I've been with John at a bar where he's been served an alcoholic drink where he's thought that it was not alcohol. He's asked for a non-alcoholic drink, and the bartenders accidentally served him a drink, and he's taken a sip, and I'm like freaking out. Oh my God, you've taken a sip of alcohol. I said, relax. It doesn't trigger anything for me. And I think that that's something that's important to get that message out, because you hear so often about people who are struggling with drinking, and then they'll take a sip of alcohol, and then it all of a sudden
falls off
the wagon. It doesn't happen with this treatment.
Yeah.
And maybe John should share the results of your trial, because the results came out just a couple weeks before he married my daughter Kate, and the results are amazing.
So how many people were in the trial then?
I think 93. They were aiming for 100, but then COVID happened. This went from 2015 to 2022.
So this was just for
alcohol
addiction. I see. All right. So out of 93 people, half of them get a placebo or so. Or at the end, you said everybody got a
at the end, yeah. And this is a little fuzzy, but I think this is close to accurate, if not accurate. I think 48% stopped altogether, which is, I mean, and I'll give you an example. That's why when we're talking about the Salvation Army earlier and heard about the 30 something percent, 38,
Yep.
I was blown away, because when I went into rehab, they told me that we all had a 3% chance
Right.
of succeeding this first time, or this current time,
Right.
this stint. And I was shocked at how low that was, and questioning, why am I even here then?
Right.
And so in that group that got the psilocybin, it was 48%, I think, stopped altogether. And then there was an 83% reduction in heavy drinking too. So I've talked to folks in my trial where they just drink socially. I mean, legitimately drink, have a glass of wine for Thanksgiving with extended family,
Right.
and that's it.
Yeah.
And when I was in the middle of my trial and I wanted to know how the other patients were doing, because I had known by then that I was never
It worked.
that it worked.
Yeah.
And the doctor said, some of the patients have had your outcome. Some, maybe it didn't work that first time, or they're still in the trial. And some can drink moderately now. And I almost got upset with the doctors because I didn't know that was an option for me. I would have, if I knew that going in, that I could just drink like a normal person and handle it. I think I would have went that avenue. And then as soon as that thought popped in my head, I'm like, what are you thinking, you idiot? Like, you just found the cure to your addiction that you've been looking for a better part of the decade.
Yeah.
And now you're upset because it wasn't a different outcome.
Yeah. So I can now visualize your trial and see exactly what happened there, and I know they're ongoing, right, in the area of addiction. So you've now become much more aware of the different trials and different issues that psychedelics could address, such as the PTSD stuff. So you've talked to people, and share some of that from your knowledge of people you've spoken with, that where there has been benefits through psychedelics with people who have severe PTSD.
Oh, yeah, there's one individual who went through one of these trials, and he now goes back to active combat zones and war zones to
Really?
deliver humanitarian
Wow.
aid.
And these are people who they would have flashbacks or feel that they're back in battle and fearful of it, therefore suffer, mental paralysis or whatever it might be, or fear, and all of a sudden that is gone.
Oh, sure, and rightfully so. And I think, speaking with him, I think he mentioned that even prior to doing this trial, fireworks would set him off, and I totally get it. You're hearing a lot of that noise, and now I think I was on the phone with him one time where I heard like these sirens in the background, and he said, yeah, but the old me would have freaked out about that.
Yeah.
So I mean, that's how well this works for a lot of these participants that are just treatment resistant, that have nothing else. And that's that's also something that we want to make clear, that we're trying to do this for the patients out there that have serious mental health issues, that are treatment resistant, or that have tried a few or multiple options, none of which are effective for them, or perhaps even have negative side effects, and just trying to get more options for them.
Yeah. No, that's very incredible stories. And so President Trump signed an executive order to pretty much allow for more testing of psychedelics in a medical context.
Yeah, we're very grateful to President Trump for signing the executive order to help. It's really going to help streamline the process, if you
I
will.
see.
We have a lot of red tape, especially once these drugs get approved by the FDA. Then you have to deal with the DEA because they're Schedule 1 compounds. And so the fact that President Trump recognizes that we need to sort of streamline that process and we need to get more research, we're very grateful. And we're also very grateful to the veterans because there is a large group, as we were just talking about, PTSD. And most of our veterans now are going outside the country in order to get help because we haven't come that far in terms of getting research in this country done. And so it's really highlighted this issue with the administration. And, these are veterans who are putting their lives on the line for us. They need help now.
So what would be that final outcome? Would it be a drug would be prescribed, a psychedelic drug for this purpose, and this would be the treatment that you'd be allowed to operate or to be able to deliver the drug? I mean, is that what the full outcome would be through an FDA review process, and a treatment plan would be required, and very, very precise how that drug could be used?
Exactly. Exactly.
That's a REMS process, a risk evaluation mitigation strategy, where,
And that would be a part of a kind of a national process that would allow that drug.
Yeah. So this is, and this is the difference, going through the FDA and doing this federally as opposed to the state, patchwork
Yes.
or ballot initiatives,
Right.
where, doctors can prescribe these and administer these medications. And hopefully insurance can cover it. CMS, TRICARE, the VA can start administering these treatments.
So that, the way I started is kind of the way I will end up. I mean, we have a senator in California that has introduced a bill twice over the last couple of years to basically legalize psychedelics for recreational use. And that's really, really scary. And therefore, I think you'll continue to have people, legislators or states or initiatives in various states, say, okay, this is now going to be legalized by the federal government. And what is so powerful of your story is the true medical benefit that's provided, not recreational benefit, but medical benefit, as long as you stick to that strict formulary and process. So I know, Mimi, part of your mission is to make people aware and to help along through your knowledge of the federal government, the process of legalizing a medical path for psychedelics.
Exactly.
So what have you been doing in that regard?
So first of all, we started the Psychedelic Advancing Therapies Caucus, the first in history. And thank you to Lou Correa, our local member of Congress here, who's the Democrat. It's a bipartisan organization. And then we have Jack Bergman, who is a general in the Marine Corps, who is a Republican from Michigan. We formed the Path Caucus in November of 2022, and we launched it. And then in November 2024, John and I co-founded the Association for Prescription Psychedelics. And these are the companies that have breakthrough therapy status who are going through the FDA trials right now, have come together to educate members of Congress to help make sure when this when this treatment becomes available, that we are ready and we have the framework in place from a government perspective, because the ultimate goal, as we've mentioned, is to get this treatment to as many people as possible and ultimately have insurance cover it.
Yeah. Well, what a powerful story. So thank you, John, for coming and sharing, and Mimi for the introduction and being here. And it's a very topical issue because something's going to be happening because of these first big steps that have been made. So really appreciate hearing your story and hearing a way forward for all of us.
Well, thanks for having us.
Yeah.